When faced with a diagnosis of cancer, patients today have more than one choice for treatment. One cutting-edge but controversial method uses heat to fight the disease. Tonight, Jeff Nguyen introduces us to two local women who are battling breast cancer with what's called hyperthermia.
Whenever you hear that word, the C word, it equates to death.
Leslie Perea from Venice Beach had dreams of marriage, kids, and a thriving career. But all of that changed last year when she was diagnosed with breast cancer.
Your whole life is on pause, and you don't know if you're ever going to see those things.
Like Perea, Angela Robinson was also diagnosed with breast cancer. Both women chose to fight the ticking time bomb inside of them with a procedure called hyperthermia.
My primary doctor offered the traditional medical treatment, which is to cut, poison, and burn, which is surgery, chemo, and radiation.
The women chose what they believed was a less invasive option with few side effects. To them, chemotherapy and radiation were like grenades inside your body, indiscriminately wiping out the good cells along with the bad.
Even my own family was telling me, you are gambling with your life. Do you realize that? You waited 8 months. Your tumor has tripled. What are you doing? And I didn't have an answer.
This is a story about putting your faith in something at a time when your life depends on it. How do you go with conventional science when you're not ready to embrace steps like surgery as a clear-cut answer?
Hyperthermia is the treatment of cancer using heat.
Dr. Bicher is the founder of the Bicher Cancer Institute in West LA. Machines like this deliver heat through ultrasound or microwave directly to the tumor for about an hour. Then the patient undergoes low-dose radiation treatment for about 30 minutes, 5 times a week for about 3 months.
Hyperthermia doubles the effectiveness of radiation.
Hypothermia is approved by the Food and Drug Administration and is being offered at Duke University, UC San Francisco, and St. Louis University. Dr. Bicher says 80% of his early-stage patients have survived at least 5 years after treatment. But other cancer experts like oncologist Christy Funk doubts the effectiveness of hyperthermia.
In order to kill off tumor cells, be it through surgery or chemotherapy or radiation, the accepted standards that we use, you do have some sort of collateral damage, so to speak, of healthy nearby tissues.
Before Leslie Perea chose to go with hypothermia, she consulted with Dr. Funk, who was given permission by her former patient to talk about her case. Dr. Funk advised her she needed surgery to remove her tumor. In fact, during one visit, Dr. Funk wrote,
I reiterated that this could metastasize and she could die.
I told her that this disease could spread throughout her body and she could die from it if she didn't pursue treatment. And I stand by that 100%.
I never want to do this again in my life. It's too hard.
This is cell phone video that Perea recorded of herself on her last day of hyperthermia treatment. That was nearly 3 months ago. Today, Dr. Bicher says MRI and PET scans show that her tumor is gone and she's cancer-free. But Dr. Funk says, not so fast.
No, she's not. We have an ultrasound after her treatment documenting that the disease is still there. It's smaller, but it's still there.
Leslie Perea says she has faith in her treatment and no longer feels the tumor that once lurked in her body, while Angela Robinson is hopeful her treatment will be effective. 2 women placing faith in one option they hope will extend their lives.
It really makes you realize how precious life is, and I think at that time in my life, I had almost forgot.
Dr. Bicher says hypothermia is also effective for both head and neck cancer as well as prostate.
I would have been out in 3 months. A stage 2 breast cancer out in 3 months, that doesn't happen. You know, that's a great thing. There was a woman who was even more, she had less time than I did here, 1.5 months. And she had stage 3, she had it in her nodes. And she was out, you know, faster. Oh, yeah.
Well, I just wanted to ask, I believe obviously you were insured, so that was a lot easier to come to our clinic, right?
Right, so that makes a huge difference. I mean, so many naturopaths do not take insurance, and so many alternative treatments, they're not covered. That cryoablation that I had mentioned, that wouldn't have been covered. I think it was going to be like, you know, $8,000, $10,000 out of pocket. But yeah, the clinic, VCR, I had Blue Cross PPO, and they covered everything. and everything. They don't even bill you for the remainder. So, and that in and of itself is unheard of. I mean, that just doesn't happen. So, yeah, so that makes a difference, I think. For me, it made a difference, and I think for a lot of people, as to whether or not they get this kind of treatment or they don't.
Right.
You know, it's huge to have insurance cover something. It makes a difference between whether you're going to do it or you're not going to do it. I mean, very few people have, 10, 20 out of pocket. This would have been thousands upon thousands of dollars. Who has the money to pay for that?
Right.
Just,
So where the system is here in medical planning, then this would have been the only way for a lot of people, actually.
Yeah, I mean, it's a shame to say that insurance dictates your treatment, but it does. And for anybody that would like to contact me with questions about BCI, they can reach me at 805-300-4339, and that is my cell number. An email works even better, actually, and that is it. I have a Gmail account, and it's LES for Leslie, and then my last name, which is Perea. That's spelled P as in Peter, ARRILLA @gmail.com.